Welcome back to our channel. Today, we're going to share with you 10 essential tips for managing diabetes. Diabetes is a chronic disease that affects millions of people worldwide. It is characterized by high levels of sugar in the blood, which can lead to serious complications such as heart disease, stroke, kidney disease, and nerve damage. Effective management of diabetes is essential to prevent these complications and live a full and active life. If you have diabetes, you know that it is a disease that requires lifelong management. However, with the right strategies, you can keep your blood sugar levels under control and prevent complications. In this video, we're going to share with you 10 essential tips that you can follow to effectively manage diabetes. From regularly monitoring blood sugar levels to engaging in regular physical activity and managing stress, these tips will help you take control of your health and live a full and active life. Let's get started. 1. Following a healthy diet. A healthy diet is essential for effective diabetes management. You should ensure that you consume a variety of nutritious foods and limit processed foods that are high in saturated fats, sugars, and salt. A good rule of thumb is to follow a balanced diet that includes a variety of foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Additionally, it is important to control portions of food and avoid skipping meals. It is also important to control carbohydrate intake, as these can affect blood sugar levels. Try to limit refined carbohydrates and opt for complex carbohydrates such as those found in whole grains and vegetables. Remember, a healthy diet is not only important for diabetes management, but it can also help you maintain a healthy weight and reduce the risk of health complications. If you need help planning a healthy diet, talk to a nutritionist or healthcare provider. 2. Monitor your blood sugar levels regularly. Monitoring your blood sugar levels regularly is essential for effective diabetes management. You should aim to check your blood sugar levels at least once a day, or as recommended by your healthcare provider. Keeping a record of your readings can help you and your healthcare provider make better treatment decisions. There are different types of blood glucose meters, some of which can be connected to a mobile app for continuous monitoring. Your healthcare provider can help you choose the type of blood glucose meter that is right for you and teach you how to use it correctly. It's important to understand what blood sugar levels are normal for you and when you need to take steps to adjust them. Be sure to talk to your healthcare provider about your blood sugar goals and when you should call their office if your levels are out of range. 3. Engage in regular physical activity. Exercise helps lower blood glucose levels and also improves insulin sensitivity. Aerobic exercises such as walking, running, swimming, or cycling are excellent options for managing diabetes. These exercises increase blood flow and the utilization of glucose by muscles, which helps lower blood sugar levels. In addition to aerobic exercises, strength training exercises can also be beneficial for people with diabetes. These exercises help increase muscle mass, which in turn improves insulin sensitivity and controls blood glucose levels. It's important to remember that exercise should be gradual and adapted to your level of fitness and individual needs. If you're a beginner, start with short sessions of physical activity and gradually increase the duration and intensity of exercise. It's also important to consult with your doctor before starting any physical activity program, especially if you have other health conditions that could affect your ability to exercise. 4. Avoid alcohol consumption. Alcohol can cause an increase in blood sugar levels and can also interfere with diabetes medications. Alcohol consumption can be especially problematic for people with diabetes as it can cause fluctuations in blood glucose levels. Alcohol affects the liver and can interfere with its ability to release glucose into the bloodstream and maintain stable blood sugar levels. Alcohol can also affect the body's ability to use insulin, which can lead to a decrease in insulin sensitivity and an increase in blood glucose levels. In addition, alcohol can interact with some diabetes medications, which can affect their effectiveness and cause dangerous side effects. If you decide to drink alcohol, it is important to do so in moderation and always under the supervision of your doctor. The American Diabetes Association recommends no more than 1 alcoholic drink per day for women and no more than 2 alcoholic drinks per day for men. It is important to keep in mind that alcoholic drinks may contain added sugar, which can further increase blood glucose levels. Opt for sugar-free or low-sugar alcoholic drinks. Remember that if you have difficulty controlling your alcohol consumption, it is important to seek help from a healthcare professional or a support group for addiction recovery. 5. Manage your stress. Stress can increase blood sugar levels. Stress can cause the release of hormones that raise blood glucose levels, making it difficult to control diabetes. Additionally, stress can make it challenging to follow a healthy eating plan, adhere to treatment, and engage in physical activity. It's important to find effective ways to manage stress. Some options include meditation, yoga, deep breathing, progressive muscle relaxation, and cognitive behavioral therapy. It's also helpful to incorporate activities you enjoy in your daily life. This can include creative activities like painting or writing, social activities like going out with friends or family, or outdoor activities like walking in nature. Finally, it's important to remember that stress is a normal part of life and that we all experience stress at some point or another. Don't blame yourself if you feel stressed or overwhelmed, and seek help if you feel that stress is affecting your mental or physical health. 6. Take your medications as directed. If you have been prescribed medications for diabetes, it is important that you take them as directed by your doctor. Taking your diabetes medications as directed is an important part of managing diabetes. Diabetes medications are designed to help control blood glucose levels and prevent diabetes-related complications such as heart disease, vision problems, and nerve damage. Do not stop taking your diabetes medications without first talking to your doctor. Stopping your diabetes medications can lead to an increase in blood glucose levels and increase the risk of diabetes-related complications. 7. Drink enough water. Staying hydrated can help control blood glucose levels and reduce the risk of diabetes-related complications. Water is an excellent solvent and helps eliminate toxins and waste products from the body. This can help reduce the risk of diabetes-related complications such as kidney disease. Remember that the amount of water you need to drink depends on factors such as your age, weight, level of activity, and other health factors. Talk to your doctor about how much water is appropriate for you and how you can ensure you drink enough water every day. 8. Take care of your feet. For people with diabetes, taking care of their feet is an important part of managing their health. Diabetes can increase the risk of circulation problems and nerve damage in the feet, which can lead to infections and amputations. To prevent these problems, it is crucial to check your feet daily and notify a doctor of any issues. Additionally, regularly washing your feet, moisturizing them, wearing comfortable and appropriate shoes, cutting your toenails carefully, not walking barefoot, visiting a podiatrist regularly, and controlling blood glucose levels are helpful tips for foot care in people with diabetes. By following these guidelines, people with diabetes can reduce the risk of foot-related complications and maintain overall good health. 9. Getting enough good quality sleep is crucial for people with diabetes, as it can affect blood glucose levels and the body's ability to process insulin. Getting enough sleep helps to reduce levels of stress hormones, such as cortisol, which can increase blood sugar levels. Additionally, proper sleep can also help control appetite and avoid cravings for sugary and high-carbohydrate foods, which can negatively affect blood glucose levels. People with diabetes should ensure they have a regular sleep schedule and create an appropriate sleep environment, including a comfortable mattress, a cool temperature, and a quiet and dark environment. Overall, proper sleep can help improve overall health and diabetes control. 10. Get regular medical checkups. It's essential for people with diabetes to undergo regular medical checkups to monitor their health status and make adjustments to their treatment if necessary. During these visits, the doctor can measure blood glucose levels, check cholesterol and blood pressure levels, and monitor any other diabetes-related health issues. Additional treatment options, such as insulin therapy or oral medication, can also be discussed if blood glucose levels are not adequately controlled. It's important to inform the doctor of any changes in symptoms or any new health problems that may be related to diabetes. In general, regular medical checkups are a crucial part of effective diabetes management and can help prevent long-term complications. These are just a few tips for controlling diabetes. Remember that each person is different, and it's essential to work with your doctor to find the best treatment for you. We hope these tips have been helpful. Don't forget to subscribe to our channel for more health and wellness content. Until next time.